recorded. So welcome everyone, and I'm going to switch to and you'll see a lovely picture of our panelists in just a second. Just to begin, this is a webinar from HC-Link Ontario. If this is the first time you're attending one of our webinars, you might wonder what HC-Link actually is. You can find more information on our website at www.hclinkontario.ca. But to keep it short, HC-Link works with community groups, organizations, and partnerships to build healthy, vibrant communities across Ontario in English and in French. We're funded by the Government of Ontario, and our services are free of charge to clients wherever we can. So that's a little short blurb on HC-Link, and you can see more on our website. So to get to the good stuff in the webinar, a couple of months ago I went to the launch of the report we're going to hear about today, the DiverseCity Counts report, and I thought it was a really great presentation, and I thought it would be wonderful to try and share it with HC-Link's clients. So I asked the DiverseCity Counts presenters if they'd be willing to do a webinar with us, and they very kindly agreed, so here we are today. And thank you again to all three of our very busy panelists who managed to find the time, and the same time even, to come and talk to us today. So a little bit about DiverseCity Counts. In partnership with Mount Sinai, DiverseCity Counts explored leadership diversity in all the local health integration networks, hospitals, and community care access centers in the GTA. And their report looked at sex, gender identity, visible minorities, disability, and sexual orientation in senior management and on the governance boards of all these institutions. So today we're going to hear about what they found, about why diverse leadership is important, and about what institutions and staff can do to diversify their leadership teams. If you want to download the full report or any of the 7 previous reports, because this was number 8 in the DiverseCity Counts series, you can get them from their website, and I've added a link to that website in the bottom right-hand corner of your screen. It's under the chat box.
Okay, nice. Okay.
If you click on the thing and then click Browse to, it'll take you there, and you can do that anytime. So what we're going to do today is we're going to have the panelists respond to some questions and give a short presentation of the results. And then at the end, we should have a fair amount of time for questions. And as I've said, we've really got too many participants today to make using the phone practical for questions. So please type your questions and comments in the chat box whenever you like. Possibly also add who you were addressing the question to. And Bonnie from Maitrey is collecting and sorting the questions for the panel, and we'll get to those when we can. So before we start, I think I'll ask the presenters to briefly introduce themselves so that everyone will be able to recognize your voices. So if we can go in the order that's on the screen and maybe start with Samir.
Hi there. So my name is Samir Sinha. I'm the Director of Geriatrics at Mount Sinai Hospital, and I have a particular interest in caring for older adults and vulnerable. And I was the lead author and investigator for this study in partnership with Maitrey and others.
Good morning. My name is Ratna Omipar. I'm the president of Maitrey. We are a private foundation in Canada. We focus largely on poverty reduction, and within that, we understand poverty as being much more than simply poverty of financial resources, but also poverty of participation, opportunities, privilege, influence, which brings us to DiverseCity Counts.
And I'm Kathy Hitchimovich. I'm the Chief Executive Officer of the Central West Community Care Access Center.
Thanks. So I think we'll get directly into the questions, which are
and my name is Natalia Pivovarov. I am community outreach worker from Toronto Public Health. And based on my work, I realized that to make a lot of wide knowledge about diverse leadership is very important. That's why I joined this webinar.
Okay, thanks. But I just want the presenters to introduce themselves for now, because we've got a whole bunch of people on the line. So please, if you're not a presenter, please mute your phone. It's *6 or the mute button on your phone. And if you want to comment or say anything at all, you can do it in the chat box, please. So thank you very much.
Thank you.
So getting into the questions. So we'll ask the big question first. Why is diversity in leadership important? And I'll address this to Ratna first and then Kathy.
Okay, thank you, Robin. Let's start with leaders. Why are leaders important? And I think we know why they are important. They set the tone. They are role models for others. They have a huge say in how priorities are set, how money gets spent, and they have a spillover effect on the rest of society. How many times have we heard people, especially young people, say, when I grow up, I want to be just like Nelson Mandela or just like Michael Bloomberg or whoever might be their leader of choice. this conversation about diversity focuses on diversity in leadership, because I think there's a whole separate conversation happening about diversity per se. We have linked our objectives to diversity in leadership for this very important reason of leaders setting the tone, exercising influence, and setting priorities. We also know it matters in terms of prosperity. Diverse leaders have links to diverse markets, to global talent. They are, under their watch, new products are able to be developed, etc. But for the healthcare sector in particular, I would say it matters from the point of view of service responsiveness and strategic direction. Everyone needs healthcare in our country. At some point in their lives, we will intersect with the healthcare sector. The healthcare is a central part of our national imagination, and with our demographics in our country going the way they are, it is important for us to think about diversity in leadership. I recently, yesterday, came across a comment by Robert Moritz, who's the CEO of PwC, who said that at the end of the day, diverse teams give you the best thinking. The best thinking gives you the best actions. The best actions give you the best results. We'll post a link to that report. It's very interesting. But in a nutshell, this is why we think diversity in leadership matters, and in particular, why it matters in the healthcare sector. You'd have to go to the report and get a better explanation than I'm sure I've given you.
Thanks. And Kathy, could you comment a little more on diversity in healthcare in particular?
Yes, absolutely. You know, any healthcare organization is a service organization by nature. And if you really want to serve your population appropriately, then you really need to understand the unique challenges that come with any particular cultural level of ability, orientation, faith group that may be within your particular constituency. The other interesting thing about healthcare is, of course, and you know, Samira can talk about this beautifully, we touch people when they're most vulnerable often, and often at their most frail, often at some of the very lowest points in their lives, and we often remove them from what they know, the community they know, the people they know, the life that they know, and put them in institutions which are very foreign to them and can be very stressful to them. Either that, or we, in the example of home care, we take our health care and try and deliver it in their homes, in their settings. And for people to really be able to thrive and get the most that they can possibly get out of the healthcare system, we have to really understand their unique needs and be able to tailor what we do to their unique needs and preferences. And we also have to be able to ensure that they actually know how to understand and access healthcare. In my particular area, which is the Brampton and Malton area, amongst the area we serve, we have a lot of recent arrivals, recent immigrants and refugees into our healthcare system, and you know, the North American healthcare system is completely foreign to them. And if we really want to ensure that they have good healthcare equity, good healthcare access, we can't assume that they even know how to access the system in all senses, or how the system works. So we really have to be sensitive to the particular needs, not only of different groups, but different subgroups within those groups. Because the needs can be different, and it all affects people's ability to be healthy and to thrive and to be able to contribute and do the most that they can do as members of their community.
Thanks. And Samir, would you like to talk about that in the context of healthcare as well? Oh, sorry.
I think building on Retna and Kathy's comments, realizing that, you know, we're serving such a diverse population, that, as Kathy was saying, is being able to interact with that population really requires, you know, having providers who appreciate what those issues are, and leaders that also appreciate kind of who those populations that their organizations are serving. So, you know, one clear example was I was at a hospital Hospital the other week, for example, and they had mentioned that there was a significant ethnic population in their area, and they said, you know what? While this is a very, very big population, we have very, very few patients who come from that community to our organization, even though we are their main healthcare organization in the area. And so they really said that they have nobody from that ethnic community who works, in a sense, in the hospital or is on the leadership. So the very first thing that they did was they said, well, in order to understand and better engage with that community is we have reached out now, and we started looking at putting one of those individuals onto, from the community onto one of our advisory councils, just so that we can start understanding where is the disconnect, how are we not serving people well. So, it's an example of making sure that leadership of organizations really reflects the people that we're serving whenever possible, or at least has a good understanding of what those issues can be.
That leads very neatly into our next question, which is why is it important to count or categorize leaders by their demographic characteristics? Maybe we'll continue with Samir there and then go to Ratna.
Well, I think it's the idea that this sometimes is an opportunity for us to reflect when we say, who is the population we're serving, and then do we have opportunities to make sure that that population may be well represented within our leadership. So I think if we don't understand who our leaders are and we don't understand who our patients are, then we're in a potential situation where we might be delivering a mismatch of care, or even sometimes culturally inappropriate or not culturally sensitive care. This is not saying it by any means that only people from certain cultural groups or certain backgrounds will understand the individuals, but I think we all would appreciate that sometimes being able to pay attention of who our leaders are and who our patients are can sometimes make sure that at least we're also keeping cognizant of the populations we're serving and the needs of those populations.
Mm-hmm. Ratna, would you like to comment in a more general way?
I would like to say that we've sort of become old hands at counting. This is the 8th report that Matri and Civic Action put out together under the Diversity Project. We have done, our previous reports have focused on leadership in the legal profession, leadership in the media, leadership in public education, et cetera, and we've come to appreciate these following imperatives. You have to know where you are to know where you want to go. I think that's really important. It's important to count because what gets counted and measured gets acted on. In today's world, I want to stress that it is important to proceed from a scientific basis of evidence as opposed to anecdotal impressions. I think we are far down along the line in this country of discarding science and basing policy on anecdotal evidence, and I don't think that's a desirable route. So at least in our local institutions, let's proceed from a fact base, let's count, let's measure, and let's report out. And this is not about, and I'd like to stress this is not about naming and shaming. It's more about naming, understanding, acting, and progressing.
Sounds good. Okay, I'm going to look at the results now. So what did you find when you looked at the healthcare sector in the GTA? And I'll get Samir's slides up here.
Thank you. So, building on what Ratna was saying, and kind of the whole raison d'être of the diversity initiative and Matri's work was, you can't. There's a great line that says you can't measure what you don't monitor, for example, or you can't monitor what you don't measure. Sorry, I got it mixed around. But the concept is that there's a huge opportunity here to at least take stock and reflect by at least just saying, how are we doing and where are we? So really just to walk you through, and I'll try and go quickly here, but we'll have time so that we have time for questions here. So our survey basically looked at our GTA healthcare institutions. So that was our 5 LHINs, our 5 community care access centers, again, the organizers of home care, and our 28 hospitals. And of course, there are many other players within the healthcare sector, but we decided just to focus on some of the larger organizations for this inaugural study. We conducted the survey in July of 2013, and what we did was we distributed our surveys to the CEOs of the 5 to all of these organizations. And then the surveys really asked the CEOs to really take a stock of their senior management teams and their governance boards. And in other words, we asked them to count, to the best of their knowledge, senior managers and board members across a number of those demographic characteristics that you see there. So I'll just advance the slide there. So we were really happy to see that we actually received a 100% response rate. So the CEOs did, all generously participate, and this included 445 members of senior management and 622 board members in total. So what do the results show us? So the next slide shows that women are actually very well represented in all leadership positions. And we found that in senior management teams, the gender balance actually favors women, with 61% of senior management positions being held by women, and that's particularly in the case of our CCACs. But through all organizations, there's a good representation from women. The next slide looks at also shows that, on the other hand, 40% of our board members are women, so less than half. And this is on par with what previous research has found on the proportion of women on the boards of the education, voluntary, and public sectors. Again, the other reports that Maitrey and the DiverseCity Counts initiative has shown. We also found that there were no gender alternates, that is transgender, transsexual, or intersex individuals in senior management or on boards of any of the institutions surveyed. The next slide looks at our visible minorities. And what we found was that visible minorities are underrepresented in senior management teams and also on the boards of their organizations. In fact, only 16% of senior management teams and 15% of board positions were held by visible minorities. And you compare that to the GTA population, for example, where nearly half, or 47%, of our GTA residents are visible minorities. Next slide also notes that the number of board positions reported to be held by visible minorities is about 15% as well. Our next slide shows us that these numbers also vary widely amongst institutions, so that some institutions reported 40% of visible minorities on their senior management teams and 33% of visible minorities on their boards. So some, where there's a very good representation rate. But we had noticed that many organizations reported 0%. That's the fact that they had, that 40% of our institutions reported no visible minorities in their senior management teams, and nearly 1/5 reported no visible minorities on their boards. The next slide actually shows that, in general, visible minorities are underrepresented in leadership in general. So again, as I was saying, this is one of the series of reports done by Maitrey and DiverseCity, looking at other sectors as well. And these numbers show that when we look at the healthcare sector in particular, this puts us somewhere between the voluntary sector and elected officials. But we're lagging behind the education sector and government agencies, boards, and commissions, which themselves lag behind, frankly, the reality of today's population as well. The next aspect looks at aspects of disability, and you can see here that there really are very few people within our senior management and boards that we know of have a disability, for example. So the reported number was very low, only about 1% across the sector, with the vast majority of institutions, 87% in fact, reporting no people with a disability in their leadership. So you compare this to our population, and about 16% of Ontarians are currently living with a disability. So that's about 1 in 6 people, and yet our institutions report only 1 in 100 in their leadership teams. When we look at LGBTQ individuals, there are a few, again, in our leadership teams, for example. So we found that few individuals were in leadership, but there were a few exceptions. So across the institutions, about 3% of senior management positions and 4% of board positions were reported as being held by LGBTQ individuals. But the average figure also includes the majority of institutions that reported no LGBTQ individuals and a few that reported some. There were also a few outlier institutions that reported numbers as high as 30 or 70% of their board or senior leadership teams were made up of LGBTQ individuals. So when we see some of the varying results, for example, what are some of those factors that tell us that there are some organizations that have very good representation from, say, LGBTQ individuals or visible minorities? And so there were some factors that we talk about in the report that we should keep in mind when looking at things like this. First, some of the results reflect a current or historical focus on some institutions. So as we know, some of our institutions were founded with a specific focus on certain populations and communities, such as women or people living with HIV/AIDS and religious communities. And so the leadership of these institutions might continue to reflect these roots and the priorities of their organizations. Second, it's also possible that the relatively high proportion of women in our leadership might be the result of a tendency of nurses and allied health professionals within the healthcare sector, which in these circumstances, many of these professionals are women. And so, and many of these individuals are likely to rise through administrative and management positions into these leadership roles. We should also make it clear that we asked the survey asked our CEOs to count, but did not ask them to account or explain the compositions of their leadership teams. But we believe that these factors are just some of the many factors that can help account for some of the differences as well. Finally, if you'd like to read the full report itself, I just give you a very, very high-level overview. The full report is available on diversitytoronto.ca, and now I will leave it there for now, but I'll welcome your questions during the Q&A period as well.
Okay, thanks very much. I'll go back to their slides, and that will leave your link at the bottom right there for anybody who needs it. So you got 100% response rate. I'm really impressed by that because I've never ever managed that myself, even in surveys where I've been able to go down the hall and nag my actual colleagues to answer my survey. So how did you do that? Maybe I'll address this to Samir first. How did you manage to achieve 100% response rate? That's really impressive. Any comment from Samir or possibly Kathy?
Well, let me weigh in while we get to Samir. I think one of the reasons we got 100% response rate, because frankly it was someone inside the institution who was a leader who was taking a lead on this project. That was Dr. Samir Sinha. In fact, Samir came to us with the project. This is the first time Diversity Counts actually did the research in partnership with the sector. So we did it with you as opposed to you. And I think that made a huge difference. And the fact that the letter went from Samir to the CEOs of the hospitals and the CAOs of the hospitals and the LHINs, etc., I think that made a difference. And I also think it reflects a level of awareness and possibly concern and curiosity on the part of the leadership in the sector.
I think as well, what, as Ratna was saying earlier, I mean, what was very positive about the approach that diversity has taken in the past is this is not about naming and shaming. This is an important issue already. Already a number of hospitals have been working with Maitri and the Diversity Initiative to really try and address this issue. So this was, a known issue, and I think a lot of organizations were happy to participate. Well, all the organizations were happy to participate because we would share back with them their data. We'd also give them an opportunity to understand how they were doing relative to others within the sector as well. So I really think this ended up being a very positive experience. Everyone was more than happy to participate, and Kathy might be able to speak from the sense of being one of the CEOs who was requested to participate.
Yeah, absolutely. I think there's two factors behind the 100% response rate from my perspective. Number one, I absolutely agree with Ratna's assessment that having Samir's leadership behind this was really important because he's a very influential person within our healthcare system, and there's a lot of respect for him as a leader. But secondly, I do think as well, it really speaks to the fact that particularly within the GTA, there's a strong commitment to the importance of diversity and the importance of respecting and understanding diversity, of measuring how we're doing against our goals, and for really understanding that this is something that we all need to be aware of, mindful of, and constantly working to improve our ability to serve our diverse communities. So I think it's a real top of mind issue for most healthcare leaders within the GTA. And I can speak for my own organization. We have a set of organizational values, and one of our organizational values is diversity as an asset. So, you know, diversity makes it into the values of our organizations. That's how important it is to us.
Which leads really tidily into the next question. So what effect has diverse leadership at board and staff levels had on your organization, Kathy?
Well, exactly that. Because we've got significant diversity within my actual staff, more than 50% of my staff are visible minorities, and that's not counting my disabled, my LGBTQ, and other staff. But just visible minority within my organization is more than 50%. And we have a number of diverse board members as well. So it has really affected how we operate and how we think as an organization. I will say that diversity begins at home, and so we ourselves did a lot of work around how we work together and how we celebrate the diversity within our organization, and I'll talk a little bit more about that later around some of the results we've got about that. But I think that a couple of things really stood out for me. When I came to my organization about 5 years ago and understood that we had a number of diverse cultures that we served that weren't being particularly well served by the traditional healthcare system, and my staff proudly informed me that we were translating brochures into all the top languages, and I thought, gee, that's really great. And then I started working with my board members who came from some of those cultures, and they said to me, Kathy, you know, translated brochures are useless. Number one, you know, this particular culture over here is an oral-based culture. They don't tend to get access to health information for reading. It's passed down from the matriarchs in the family. And if you want to influence health behaviors or how people are accessing the health system, you have to get to the health matriarchs within the family. And by the way, they don't read to get access to their health information. So, okay, how do they get access to their health information? Well, this particular culture listens to the radio a lot. So that's where they get their information. That's where they're culturally grounded within their community. There's a specific radio station dedicated to that community. And if we want to really influence their ability to understand what health care is out there and available to them and how they might access it or influence some of their thinking around healthy behaviors, we needed to plug into that radio station and plug into the oral culture. So we did a complete 180 in how we were trying to get information to that particular community. And we have greatly improved and increased our interaction with that community, our sort of penetration into them understanding that we're there to help them and how they might access their services, and also the ability to dialogue with them to understand their specific issues. We actually participate in radio phone-in shows in their language because having such diverse staff, I've got lots of people who are able to communicate in that particular language, and so they can have radio phone-in shows, they can ask questions, there can be dialogue. We do oral satisfaction surveying where we phone and we ask the survey questions in their language, and they have an ability to again give us their particular feedback around the satisfaction with their services in their own particular language. One of the other things that we did is we understood that there are some cultures that are not as satisfied with our services as others. And so when we broke down our satisfaction survey results, we broke them down by language. so we understood, we didn't just lump it all in so it kind of got washed out. We specifically said we want to understand how well our specific subcultures are satisfied with the services we're providing. So when we broke it down by language, we ended up finding there are certain areas that aren't as satisfied with our services as others. So then we did a deep dive into, well, why are they not as satisfied with our services? What is it that's not working? What is it about the way in which we are delivering our traditional North American healthcare that isn't working for them? And then we got that feedback. We worked with the community to understand how to change what we were doing, and then we did actually a pilot project specific to that community where we changed the way we delivered those particular services and then resurveyed them and got 100% satisfaction with the pilot group that we did. So that was a really good feedback loop for us in working with that particular community around how to change what we do to meet their needs. We also, I talked about having a diverse workforce, and it's really important, I think, to the future sustainability of providing a vibrant workforce, that we understand the needs to respect and accommodate cultural and other forms of diversity within the workplace, because we do have a changing demographic, and that means a changing workforce. And as I said before, over 50% of my staff are visible minorities, and we actually did an employee engagement survey where we asked the specific question, are people from diverse cultures, do they feel welcome within our organization? And our results came back and showed that 89% of our staff agreed with that statement, that people from diverse backgrounds feel welcome in our organization. And while this is, relatively high, the national average was 13% lower, so we were 13% higher than the national average. 89% is still 89%, which means what are we doing about the other 11%? It's our goal to continue to strive for 100% of our staff from diverse backgrounds feeling welcome in our organization. So while celebrating that we're 13% above the average, we've still got a significant way to go if we have some people who still don't feel that they're welcome in the workplace. So it is a real challenge, not only from delivering the services out to our particular patients and constituents, it's also understanding your particular workforce and how you make sure that your workforce feels comfortable and accepted and accommodated within the workplace so that they can be the best that they can be as employees. Anyway, I'll stop there because I could go on for a while.
Okay, so you've talked a good bit there about the practical, the doing of the service, but what are some of the practical actions that healthcare organizations can take to diversify their leadership? How do you go about diversifying your leadership? And I'll address this to Ratna.
As I said before, let's start from a basis of fact. So if an organization wants to diversify its leadership, it should count its own leadership, and by that we mean senior management and the board and the foundation boards. Most healthcare organizations have foundation boards as well. And then develop a plan of action, dedicate some resources to it. I like plans that are practical as opposed to aspirational. I prescribe wholeheartedly to aspirational statements that we must end racism, but I am a great friend of practical, actionable, tangible, doable, measurable strategies that move the needle significantly. And then I suggest that on an annual basis there is a measuring of counting and public reporting out. So those are the actions that I would suggest. We have, by the way, 10 tips on how healthcare organizations can diversify their leadership. You can find these 10 tips that are being sent to you right now in the chat box. But my top favorite 3 are develop a baseline of information, a plan of action, measure, count, and report out.
Like a straightforward plan? To take it a little bit further, I mean, I'm not in leadership in my organization. As a staff member, what can staff do within their own organizations? And I'll address this to Samir and then Kathy.
Yeah, I think Samir here. So I think the goal is with this is that I think leadership is very helpful in setting the tone of the organization. So I think Kathy, as a CEO of a major healthcare organization in the GTA, you can clearly hear from her tone that an 89% approval rating is great, but what about the other 11%? So there's a relentless focus in her organization from the top, from the CEO, to make people feel valued and understood. I think as well, but just because the CEO thinks this is important, I think there's an opportunity for staff to step up within their organizations too, so that they can say, you know what, I don't really feel comfortable working with this population. I may not be, I may not, share their worldview, if you will, or have the same experiences or cultural background, but I'm very interested in learning more. So staff being proactive in terms about learning more about the populations they serve, how they can better adapt their own skills so that they can provide culturally safe and appropriate care. I also think it's also celebrating and championing diversity. So trying to recruit other staff or tell other staff or work with their patient populations to try and understand where some of the needs for they and their fellow staff to learn more, or to even help ask the organization and their CEOs to say, can you help prioritize and make this more of an issue? So there's lots of things that everybody at every level can be doing, including patients and members of the public who can also be working with their organizations to say, are you aware of this population that lives in your community, and opportunities to better serve and work with them?
Robin, if I may, I'll throw in something from the report that strikes me as a nice response to your question. On page 15 of the report, we highlight the Toronto Central CCAC and their leadership in diversity, and Dennis Fong, the Senior Director, HR and Organizational Development, says that if you don't have diversity in the candidate pool, you will never have diversity at any level. So reaching a little below the broad strategic statements of the must-have leadership at the senior level, I think there's a very practical example of how you can actually go from A to B by setting down objectives of having diversity in the candidate pool, and he's particularly referring to the candidate pool for boards.
That's a good point. Kathy, do you have any comments?
Yeah, absolutely. Just to pick up on Ratna's point too, a plug for DiverseCity on Board is a recruiting tool. We've actually used it.
Thank you.
Through Maitri. We have used that recruiting tool successfully to recruit some really high quality board members from some of our diverse cultures. So I will say that that's an incredibly useful tool. But to your question about what can staff do, I think Samir's point was excellent around it's really about celebrating. It's also around respect and tolerance and understanding and having a curious mind and not a closed mind. So it's part of the organization culture, but organizational culture is the responsibility of each and every person that works within the organization. And so it's really about being proud of our individual cultural or orientations or backgrounds, whatever they may be, being really respectful of the differences where they exist, asking questions, being willing to educate others on working with a particular community, their practices, their beliefs. We greatly value celebrating all of our cultures. So we do some regular cultural celebrations within our organizations, and various cultures are welcome to initiate celebrations of various events within their cultures within our organization, and we all participate in that and learn and understand. And we also, want our staff, and I talked earlier about our staff being ambassadors or bridges between the organization and particular communities. That helps not only from an education and understanding and feedback perspective, but to Ratna's point, it really also helps with recruitment. because people, when they're looking for opportunities about where to work, they often talk word of mouth about where's a good place to go and be employed. And if you have people from a particular culture working in your organization and it is a positive experience for them, that helps attract more people from culturally diverse backgrounds to come and work in your organization. So it really is, success breeds success.
Those are great.
If Robin, if you'll allow me to jump in once again, I thought the audience would be interested in some ancillary research we did, which is important because it deals with the issue of tokenism, and there are some questions here around tokenism. That in a group of 10, when you have one diverse individual, however you identify diversity, a woman, someone who's disabled, someone who's a visible minority, or whatever, one in a group is likely to be viewed as a token. Mm-hmm. Two in a group of 10 are likely to be viewed as a special interest group. It's when you have 3 that you tip the scale. So, I'm going to urge all of the leaders who are listening into the conversation not to be simply happy with one of a kind. That's simply not enough at the level of diversity that the GTA is experiencing. So set your bar high so you can actually reap the full benefit of diversity.
Mm-hmm. Sounds like a great idea. Okay, I'm going to transition into the question and answer. So people on the phone, please think up your questions and type them in the chat box. And in just a second, I'll make the chat box much larger so we can see more of it. But just to give people a bit of time to compose their questions, I'm going to ask our panelists one final question, which is, having done this and your 7 previous reports, what other research questions should we ask next? What else is left to do out there? Ratna, do you want to comment first?
Well, I think it's not enough to do this research once. And I would urge your leadership, Health Nexus, Mount Sinai, whoever is ready to step up to the plate, to repeat the survey at strategic time intervals, whether it be every 2 years or annually, to track the progress. It's a mirror that you throw up to your own institutions to sort of say, here's the baseline, here's where we're going. We do this, the DiverseCity Counts report, which again is produced by Matri and Civic Action, has done this annually. And because leaders don't simply get up and leave from one year to another, that's not the way board positions or leadership positions work. It is important to take a sort of a longer term view on this. And when we started the survey, we found that in a city region where roughly 49% are visible minorities, our research focused particularly on visible minorities, only 13.2% of leadership positions were occupied by visible minorities. 4 years down the road, we found that had moved slightly up to 14-point-something%. And you can see all these reports on the diversity website. So, keep at it, keep measuring, keep reporting, keep aspiring.
Okay, Samir, any comment on the next research question?
Yeah, as Ratna was saying, our goal was, this is our very, very first attempt doing this, and diversity has certainly led the way over the last number of years. They're really about looking at the question of visible minorities in leadership positions. And so this was a fun project to do in partnership with them, because we wanted to start looking at broader issues of diversity, like our LGBTQ populations, individuals with a disability, for example, as well, and gender. So we started asking some broader questions. We would certainly like to repeat this in future, because again, you can't really monitor what you don't measure, if you will. So we'd like to do this in future, and I think the 100% response rate makes me hopeful that this will continue to be an issue that everyone wants to support looking at. I think the other aspect is, I think we would certainly like to look at maybe other communities in future as well, as we expand that definition of diversity, for example. So looking at members of our Aboriginal populations, for example, or our Francophone communities, communities that are otherwise defined in different ways in terms of their diversity. So I think there's opportunities to look at this a bit further, and certainly see if we're moving the mark that way as well.
Kathy, any comments?
No, I think they've covered everything I would have said. That's perfect.
Okay, so I'm going to move to the larger chat screen here, and now I've lost my presenter questions. Oh yes, up thread a fair ways, a number of people were questioning and commenting on your decision to use the term visible minority versus race or ethnicity or people of color or that kind of thing. Does anyone want to comment on the choice of terminology in that?
I think I'll start off, and Samir and Kathy can weigh in. The DiverseCity Counts report that have, 8 to date, have used the term visible minority to reflect the language that is used both by Stats Canada and by the employment equity legislation. We thought that was strategic. We worked with Ryerson, Professor Wendy Sukier in particular, to develop the research methodology, and we were advised to use standardized terminology that is used across other sectors, because then it becomes easier to compare, contrast, measure, report out. If this changes, and certainly in a context like the GTA, it's questionable whether the term visible minority is the right term. Should we be called visible majority? Should we be called racialized communities, etc., etc.? That's a conversation I think we should have at the local level, and in fact, Maitree will be convening some of these conversations and writing up some recommendations on that. But at this point, as long as Stats Canada and the Employment Equity Census use that terminology, I think we are strategically advised to use that as well.
I think as well, it's just Samir here, I think as well one of the aspects is that when we start looking at diversity, we know it's a very, very complicated field to start navigating. And so so people say, well, what I identify myself as is not what actually I look like, for example, and therefore what is the right term and how do you do this? You have to remember that in order to do a study like this, where we're really just interested in getting a snapshot and really doing something more superficial, we really had to use some kind of blunt measures, if you will, that at least started getting us asking the questions and doing this. So we were really using the philosophy, don't let perfection be the enemy of the good. Certainly if we had more resources, more time, some people also said it would probably be much better if instead of the perception of the CEO of who their staff are, many of the counts that we did were probably an underrepresentation of people who of aspects of disability, for example, or those individuals who are LGBTQ individuals, for example. So there likely was, and we state this in terms of our limitations in the study. We are understanding that, but we thought that we shouldn't let perfection be the enemy of the good, and certainly just try and start with something.
Yeah, Samir, you make an excellent point. Within my own organization, I know that when we filled out this survey, I actually had to approach some people and ask permission and talk to them about how they wished to be counted or not counted within the survey, because the level of comfort with transparency about lifestyle choices or sexual orientation or some other non-visible forms of minority, can be very sensitive issues. Not everybody is entirely comfortable with being quote-unquote counted, but I think that we have to understand that and be sensitive to that, and still try and move ahead in a way that makes it comfortable for everybody. But it is a challenge.
And a question just popped up, Kathy. What kinds of feedback did you get when you asked these very personal questions?
Okay, so are we talking about around disclosure? Is that the question that we were talking about? Sorry.
I guess it was just kind of what kind of response did you get when you approached these people and asked?
Not everyone was comfortable with disclosing and being counted. And, within my organization, I happen to have of my board and senior team, that's who we were counting in the survey, I happen to know some things about some people that perhaps they haven't publicly disclosed, but they have disclosed to me. And before I actually, filled out the survey, or we filled out the survey on behalf of the organization, I actually approached them and talked to them about whether they were comfortable being counted, because once this went public in a fairly small organization, there's only so many people on my board, there's only so many people in my senior management team, and when the results go public, people will read that and say, oh, they might think, well, who is that? And I didn't want to put people in a situation of being questioned around information that they weren't comfortable disclosing. So some people were, thankfully, but I did have one individual who was not comfortable, and so I did not count them.
And I think one of the aspects, too, is, again, I think one of the reasons we had 100% response rate is because we also understanding, that if you have the ability to zero in on one organization, do people feel that they could potentially be targeted, or they could be identified where they may not want to be identified with this aspect being known about them, for example. And so we did actually tell our organizations that while we will actually have the data, as the researchers, the data will only be presented in aggregate at the sector level. So that, but regardless, we want to be honest and open about that. Even some individuals say don't want to still be counted, even if within all CCACs this is the information that may be provided. So it still reflects how sensitive this is as an issue for some individuals to explore and to write around.
Okay, there's a slightly different question from further up the thread. Do you think that changing the curriculum in universities and colleges and similar programs would make a difference in how executives and management hire and include different voices? Maybe Kathy would like to address that one?
I'll say yes and no, in that I always believe that training and education around cultural competence and sensitivity to different populations and cultures is vitally important. But I really go to Ratna's point that it goes well beyond that. It's actually having those people actively represented on your board, in your leadership team, and on your staff that really starts to strongly influence and change the culture of the organization and how you think and how you deliver the services you deliver. So while it's a great first step, I don't think it's enough personally.
Necessary but not sufficient, kind of thing.
Right, if I may add something around the curriculum at the management school level, MBA programs, Rothman, Schulich, etc. I know I lecture quite often at these institutions, as do I'm sure others as well, and I have noted that these lectures or this focus on diversity or curiosity about diversity at the MBA school level is an elective. It's like you come to this lecture because you're interested. It's not a core markable part of the curriculum. So I think we have some work to do.
And I think as well, when some of the work that Maitri has presented around and the DiverseCity Counts initiatives presented around is how, from a business perspective, if you look at business alone, how diversity can actually improve an organization's competitiveness, for example. Or, when we think that our population is more diverse, then recruiting more diverse talent means that there's better access to certain networks of individuals. Your organization might actually have better results because it can, in terms of working with the population from a healthcare perspective, because if we really are well engaged and we know what we're doing and well linked in with the community, we're better likely to serve and meet the needs of that community as well. So I think making sure that people, especially in a more competitive healthcare and business environment, appreciate kind of how diversity, in a sense, can be strategic for an organization as well. I think it's just helpful to raise that in the consciousness of leaders and organizations as well.
There's a few questions that sort of hint at to get back at the whole idea of tokenism. and whether people on the boards or in the leadership feel they're being heard and whether they're able to make a difference, or are they just mere numbers? Does anybody want to comment on that?
Well, let me take a stab at it. I have been a token on boards, and I know how that feels. But I've also learned how to go beyond tokenism to real substantive representation. And so, we're working up at Maytree. We're working up course curriculum around governance and diversity, and we are hoping to launch sometime this year a course that people can take online on how to go beyond being a member of a board to making real difference in the policies, which are, the purview of the board, policies relating to HR, policies relating to marketing and messaging, policies relating to procurement. And these are all very important instruments that board members have at their disposal. I hear I'm getting some reaction, so
Yeah, if you're a participant, please mute your line. Use the mute button on your phone or *6, please, because we're getting a lot of background noise. But is this course, Ratna, is this going to be for people who would be aiming to be on boards, or are they for, say, the Health Nexus board, which already exists and might use some professional development?
That's a great idea. Let's work in partnership with health to do this before health members. That would be fantastic.
Yeah, that would be a lot of fun. I think, because I know certainly a lot of boards are looking for professional development in those kinds of areas, so I think that would be really interesting. Does anyone else want to comment on that, the idea of tokenism?
Well, I think just to add to it, I think there has to be an organizational or board commitment or strategy around ensuring diversity on your board. So you have to actually plan around it. You have to understand the communities that you serve, and you have to really think when you're recruiting. What are your recruiting strategies, and who do you need on your board, so that you can have a thorough understanding of the various communities that you serve and ensure that diversity and diversity of perspectives is not just a token at your board table, but an actual goal, an actual objective of your board. So I think it goes to actually being very planful and conscious about it and proactive about it, and understanding what strategies you're going to put in place to find those people. Because you do have to go out and reach out and find them. I do find the passive approach, just waiting and seeing who applies, isn't necessarily an effective strategy for ensuring appropriate diversity on a board.
Samir, you have any comment on that?
Yeah, and so I agree with everything that's been said, and I think, to sum up, kind of a bit what Kathy and Ratna were saying was, I think it's a bit of a two-way street. One is that we need to have organizations and leaders who are proactive about getting individuals onto boards, but, sometimes it can be self-induced tokenism. For example, if I just happen to go on the board and then I don't feel that I have the right qualifications, for example, or I'm not figuring out how I can be a proactive member. So I think sometimes that requires us to assist those individuals a bit more to make sure that they are engaged. But also I think the Diversity on Board initiative has been a good way to match individuals, for example, who are interested in making contributions to being those active board members. And as Kathy was saying, not linking this with organizations, that are very interested in actually making sure they get those sorts of members, as opposed to passively waiting until one of those members may appear. So this matchmaking system, I think, has been very, very successful in Toronto in terms of getting active and non-tokenistic members on boards. But, as I think, as a visible minority myself, I think, I've also been one of those individuals who strategically tried to use tokened opportunities to become strategic transformation opportunities.
Okay, we're getting a soundtrack in the background.
I think people like what Samir is saying. That is, musical applause for him.
Anyway, it's time for us to wrap up anyway. Thank you to everyone who's contributed in the chat. There's lots of very interesting ideas in there, and I hope people have had time to read them, because we didn't get a chance to address them all in the questions. And I'd like to say thank you again to our three presenters who made time to come today and share with HC Link. I think this has been a very interesting chat, and I'm certainly looking forward to your next report, and maybe to partnering on the board thing, because that sounds great.
Let's action that.
So I'm going to stop the recording now, and thank you everybody for participating, and thank you again to our presenters.
Thank you.
And thank you for inviting us. I greatly appreciated the opportunity.
Oh, it was wonderful. Thanks a lot.